Hi everyone, and welcome to this 1-hour pre-recorded presentation entitled Steps to NCQA Recognition for Patient-Centered Medical Home, or PCMH, presented by the support of the Health Resources and Services Administration and the Bureau of Primary Health Care, Office of Special Population Health. My name is Juli Hishida of the Technical Assistance Program at the National Healthcare for the Homeless Council. Recently, the Geiger Gibson program at George Washington University developed a survey evaluating meaningful use and patient-centered medical home readiness for all Section 330 grantees. Out of the existing 208 Healthcare for the Homeless grantees, 144 of our programs completed this survey. Our research team was able to pull the responses submitted by the Healthcare for the Homeless programs, and with that, create a report that reflects the readiness of Healthcare for the Homeless programs to achieve meaningful use and PCMH recognition. According to this report, 78% of respondents have never applied for PCMH recognition, and 56% have no current plans to apply, or are not sure whether or not they will apply. These are large numbers considering the benefits of patient-centered medical home recognition. Another significant finding in this report were the common themes of challenges and barriers in preparing for PCMH designation that were described by the respondents. These include issues with population served, available training, limited resources for cost and staffing, time restrictions, and understanding the patient-centered medical home model. We hope by the end of this webinar we are able to provide some clarity and assistance on some of these topics and point you in the right direction of where you can go to find further assistance. The purpose of this webinar is to review the NCQA PCMH recognition process so you will have a better understanding of the application process, the 6 standards of PCMH, and the scoring guidelines against these standards. Throughout the presentation, I will provide several resources so that you are able to find and receive information that is tailored to your specific issues. An example of a great resource is a TA program at the National Healthcare for the Homeless Council. By submitting an online TA request form on the Council's website, you will be able to receive personalized technical assistance from one of our subject matter expert consultants. Responses from our consultants range from resources on electronic health record implementation to clarification on CMS meaningful use requirements to guidance on incorporating the PCMH concept into your Healthcare for the Homeless program. I will describe how to submit an online request form at the end of the presentation. NCQA PCMH designation. There are multiple entities developing or offering PCMH recognition and accreditations, but the recognition process we are going to cover today is by the National Committee for Quality Assurance, or NCQA. Through a set of standards developed by NCQA, PCMH works to improve the quality of primary care to clients by transforming the organization and the method of the provision of primary health care, so that the practice is organizing care around patients, working in teams, and coordinating and tracking care over time. Generally, the practice is redesigned that is integral in PCMH recognition and that is detailed in the 6 standards has been proven through past demonstration projects that it is successful in increasing the quality of clinical care, reducing cost of care on some measures, reducing use of hospitalization and emergency room visits, and significant improvement in patient and provider experiences. Once a program is recognized as a PCMH through NCQA, they will have that designation for 3 years and will have to go through a renewal process. A program can be recognized as a level 1, 2, or 3 PCMH. I will review criteria on each of these levels later on in the presentation. I do want to mention that for PCMH recognition, you don't necessarily need an electronic health record system in place to become a Level 1 PCMH. If you are currently planning on implementing an EHR system at your practice and are waiting to have that in place before working on the recognition process, it is still a good idea to begin to review and fully understand the PCMH model and the 6 standards. It is beneficial to understand what you need to do for PCMH recognition before the implementation of your EHR system, so that you will have in mind any prompts or reporting features that is required by NCQA. One way to prepare for recognition process is to attend one of the many training events NCQA offers that review each of the standards and the requirements in depth. The 6 standards of PCMH is meant to expand, in a systemized way, the patient-centered perspective throughout our country's healthcare system. And as you all are aware, patient-centered care is one of the most important aspects of the homeless program. PCMH has a strong focus on a few other critical aspects of healthcare for the homeless programs. These include integrating behavioral health care, care management, and consumer input for quality improvement, which is accomplished through patient surveys. One of the goals of the PCMH program that is particularly challenging to healthcare for the homeless programs due to the sometimes transient nature of our clients is a focus on the practice's ability to coordinate and track care over time and across settings. It is believed that these challenges can be overcome, especially with the use of electronic health records, as long as those are used in a way that is meant to achieve goals of coordination and high quality of care. Many of you all are familiar with the current push for health centers to show meaningful use of their EHR systems to achieve improvement in care and to receive the incentive payments from centers of Medicare and Medicaid Services. What very few people are aware of is that NCQA deliberately worked to align many specific meaningful use standards with the new 2011 PCMH standards. I will provide more details on that later in the presentation. I would like to take this time to mention the Bureau of Primary Health Care's recent announcement of a PCMH funding opportunity for current FQHCs. This is an Affordable Care Act supplemental grant opportunity meant to help with the cost associated with enhancing quality improvement systems and PCMH recognition. And this will provide upfront assistance to grantees as they make the practice changes necessary to achieve and/or enhance PCMH recognition. The program requirements and application to request this one-time supplemental funding should have already been emailed to your health center project director through the electronic handbook system. The application for this funding opportunity is due August 22nd. For more information, please visit the HRSA website, or you may follow the direct link provided on this slide. Now let's go ahead and review the agenda for the presentation. First, we'll look at the eligibility requirements and application process. Then I will review the 6 PCMH standards, how they are structured, and the scoring guidelines. If you haven't already, go ahead and order your electronic copy of the standards from the NCQA website. You can follow the direct link provided on the slide to get to the ordering page. Closer to the end of the presentation, I will discuss the regional extension centers and health center control networks as resources, and then at the end provide you with a list of other relevant resources. First, let's examine the eligibility and application process. There are certain requirements for both primary care practices and clinicians to qualify for PCMH evaluation. So to be an eligible primary care practice, you may be a single clinician that provides primary care to all your patients, or if you are a group of clinicians, you all practice together and provide primary care for all your patients at a single geographic location. The group of clinicians that practice together must also follow the same procedures and protocols, share and make available medical records for all patients treated at the practice site, and those medical records can either be paper or electronic. Also, they need to use the same systems and procedures to support clinical and administrative functions such as scheduling, ordering services, maintaining medical records, and follow-up. And again, these systems can be either electronic or paper-based. Let's look at what NCQA considers as an eligible primary care practice. An eligible primary care practice can be an incorporated group of clinicians in an office site who use the same systems and staff that was just described, or an individual clinician, whether sharing an office with other clinicians or not, but who maintains his or her own systems. It could be a group of clinicians at one location that is part of a larger medical group with several locations. Eligible primary care practice could be a practice within a multi-site group. NCQA defines a multi-site group as 3 or more practice sites using the same systems and processes, including an electronic medical record system shared across all practice sites. An eligible primary care practice could be a subset of primary care clinicians within a multi-specialty practice. All eligible clinicians practicing together at the site applying for recognition must be included in the PCMH application. Eligible clinicians are physicians, nurse practitioners, and physician assistants who practice in the specialty of internal medicine, family medicine, or pediatrics, and with the intention of serving as the personal primary care clinician for their patients. Also, you are an eligible clinician if you can be selected as a personal clinician by a patient or family. So now that we've reviewed the requirements for eligibility, let's go ahead and look at the actual application process. The application process is done online at the NCQA website, which is www.ncqa.org. You will go to their homepage and select the publications and products option on the left-hand side menu. Then you'll scroll down to recognition programs and select the patient-centered medical home option. If you've already downloaded and received the 2011 standards, this is where you went before. It'll be the same place you need to go to order the online application, and you'll go through a similar process you did to receive your standards and the guideline. Once the ordering process is complete, you'll immediately be sent a link with your NCQA username and password. So to access the application, just click on the link provided in the email. So here I've clicked on the link that was sent to my email, and I've plugged in my username and password. So I'll go ahead and log in. After you accept their licensing agreement for the software, you will be directed to your online application screen. There you will see that the application is separated in sections for your account information, your practice sites information, and the interactive survey system or ISS system. Before you submit your online application, you do have to sign a few program and business agreements, which can be done electronically and is located in your accounts manager area. You'll see the legal documents, and you can select each of these and have those electronically signed. And then this is the multi-site survey, so you'll fill that out so that you can see if you qualify. So if you have more than one site, you select yes. Click here and you'll have to do this evaluation. The Interactive Survey System Tool, or ISS Tool, is used to submit your supporting documents for your application. And you would do that through the document library and the worksheets. I will talk a little bit more about supporting documents when we look at the actual structure of the standards. The survey tool is also a good way to do a self-evaluation, because in the survey tool, the scores for each element is noted and then added together to determine the score received for that element's standard. The tool adds a score received for all standards to determine the final score. NCQA does offer a live, interactive, and free online training each month specifically on how to use the ISS tool. It is a live training, so if you have any specific questions during the webinar presentation, you'll be able to ask those questions and receive an immediate response. So I do recommend you all to participate in one if you plan on applying for PCMH recognition. NCQA recommends that you complete the application before purchasing the required ISS tools, because you will be required to order an ISS tool for each practice site you are submitting for recognition. And the application includes an evaluation for multi-site eligibility. You will need to pay the application fees before or with the submission of your survey tool. NCQA will not begin to review your survey tool until they've received your payment. An application fee is due for each practice site submitting a survey tool and is based on the number of eligible clinicians that intend to be listed for the practice site if they achieve NCQA recognition. If the clinicians are listed at more than one practice site, they're considered in the fee calculation for each site. There are 4 types of survey pricing. The standard survey pricing applies to a practice applying for the first time or for renewal. The discounted survey pricing applies to practices that are sponsored by an approved organization and applying for the first time or for renewal. For more information about sponsoring a PCMH initiative, please review NCQA's guidelines that came with your standards. Multi-site group survey pricing includes a multi-site survey fee based on the number of practices and a discounted survey fee for each site included in the group. Add-on survey or upgrade survey pricing is only applicable to practices with a current recognition status and allows a practice to advance to a higher level or from the PCMH 2008 to the PCMH 2011 designation. To be prepared to apply for PCMH recognition through NCQA, you and your administrative team must fully understand the 6 standards and how you are being scored on your application. So now I would like to give you all an overview of the 6 standards and how to understand their scoring guidelines. The 6 PCMH standards developed by NCQA are listed on this slide. And the purpose of the standards is to align with the core components of primary care and evaluate a practice's ability to function as a patient-centered medical home. Standard 1. Enhance access and continuity. So for example, this is where NCQA focuses on the patients having access to culturally and linguistically appropriate care and clinical advice during and after office hours. Standard 2. Identify and manage patient populations. This is where the practice will need to collect demographic and clinical data for population management. Standard 3. Plan and manage care. For this standard, NCQA is looking for practices to identify patients with specific conditions, including high-risk or complex care needs and conditions related to health behaviors, mental health, or substance abuse problems. And we already do a lot of this in the Healthcare for the Homeless programs. Standard 4. Provide self-care support and community resources. NCQA wants to see that the practice works with the patient or family to develop a self-care plan and to provide tools and resources, including community resources to the patient. Also, they are looking for the clinicians of the practice to counsel patients on healthy behaviors, which is part of the health education aspect of our programs, and also assess and provide and arrange for mental health and substance abuse treatment. Standard 5, track and coordinate care. And this is where NCQA will want to see that the practice follows up with discharged patients and coordinates tests, referrals, and care at other facilities. Standard 6, measure and improve performance. NCQA wants to see that the practice is identifying vulnerable patient populations and uses performance and patient experience data to continuously improve. So it may be a relief to many of you to see there's a lot of connections between the methods of service delivery for Healthcare for the Homeless programs and the PCMH standards. In reviewing the goals of the PCMH program, which are integrated in multiple standards, we notice a similar link. A few of those goals are for the practice to increase patient-centeredness, improve quality and eliminate waste, increase the emphasis on patient feedback, integrate behaviors affecting health, mental health, and substance abuse, and enhance coordination of care. So let's review the structure of the standards. We will look at specific examples in a moment, but I'll first explain how a standard can be broken down. The 6 standards each have elements, which are main components of the standard. For example, Standard 3 is plan and manage care, and Element A is implement evidence-based guidelines. And the elements are lettered under each standard, so instead of element 1, 2, 3, they're listed as element A, B, C. There are a total of 27 elements, ranging from 2 to 7 elements per standard. There are 6 must-pass elements. Each standard has 1 must-pass element. These elements are considered must-pass because NCQA recognizes these as essential to the patient-centered medical home model and are required for all practices at all recognition levels. So for each of these elements, practices must achieve a score of 50% or higher. I will talk more about the scoring process when we look at the specific examples. Each element is then broken down into factors. Factors are the documented actions that your health center takes and are the pieces of the element that are evaluated for the scoring process. Each element has its own specific scoring guidelines. Each element has an explanation and a documentation section. The explanation section provides very detailed information about how the element relates to the standard and also describes what the NCQA reviewers will look for each of the separate factors. So let's go back to the example of Standard 3, Plan and Manage Care, Element A, Implement Evidence-Based Practice. In the explanation section is where you'll find the reasoning why this element was created for this standard. In the explanation section for Standard 3, Element A, NCQA believes that in the PCMH model, practices maintain continuous relationships with patients through care management processes based on evidence-based guidelines. So this is how you see how the elements break down the standards in smaller topics. The documentation section provides a description of examples for the supporting documentation that needs to be submitted with your application through the ISS tool so that you prove that your practice meets specific factors. There are 4 basic types of documentation that a practice can use to demonstrate performance. The documented process. These are written statements describing the practice's policies and procedures. The statements may include protocols or other documents that describe the actual processes at your program, or forms the practice uses in workflows such as referral forms, checklists, and flow sheets. It is important to note that documentation of these policies and processes need to have been in place for at least 3 months and can be no more than 12 months old. The next type of documentation are reports, which is basically aggregated data showing evidence of action. So this includes reports a practice produces to manage its operations, such as a list of patients who are due for a visit or test. You can also use records or files for documentation. These are actual patient files or registry entries that document an action taken. And lastly, materials. These are prepared materials the practice provides to patients or clinicians and include clinical guidelines and self-management and educational resources such as brochures, websites, videos, and pamphlets. There are 3 levels of PCMH designation, which is meant to reflect the degree a practice meets the requirements for the PCMH model, and that is determined by the total numeric score received for each element. So as you can see on the slide, Level 1 PCMH recognition requires a score of 35 to 59, Level 2 60 to 80, and Level 3 85 to 100. The score for your program will be shown in the final results section of your ISS tool. And through the survey tool, you will also be able to see it broken down by the score for each element in standard, the number of must-pass elements achieved, and your total score. The NCQA Recognition Program Review Oversight Committee is responsible for reviewing your findings and making the final scoring decisions. The review committee consists of clinicians who have expertise in practice systems and who have no conflict of interest with your practice. This next slide gives you an overview of all the standards and their elements, and how many maximum points you can earn for each. It also gives you a good overview of which elements for each standard is a must-pass element. So for Standard 1, Enhance Access and Continuity, Element A, Access During Office Hours, is the must-pass element for that standard. For Standard 2, Identify and Manage Patient Populations, Element D, Use Data for Population Management, is the must-pass element for that standard. Standard 3, Plan and Manage Care. Element C, Care Management, is the must-pass element. Standard 4, Provide Self-Care Support, only has 2 elements, and Element A, Support Self-Care Process, is the must-pass element. Standard 5, Track and Coordinate Care, has 3 elements, and Element B, Referral Tracking and Follow-Up, is a must-pass element for that standard. Standard 6, Measure and Improve Performance. Element C, Implement Continuous Quality Improvement, is a must-pass element for that standard. Now is a good time to look at a few of these standards and elements more in detail. If you've already downloaded your copy of the standards, much of this will look familiar, but let's go ahead and start with the first element in the first standard. The title with description is located at the top of the standards section, and to the right of the title you will see the number of total possible points for that standard. So we are looking at element A for PCMH Standard 1, which is access during office hours. And you will see that it is noted in the title of the element whether or not the element is a must-pass element. Also to the right of the element title, you will see the maximum amount of points you can receive for that element. So for element A, it is possible to receive 4 points towards the 20 possible points for that standard. Below the title, you will see the factors listed numerically. So here, each factor is simply stated. Factor 1, providing same-day appointments. Factor 2, your practice needs to provide timely clinical advice by telephone during office hours. And so this is where you really get to see how patient-centered medical home is about system-wide restructuring through the practices, policies, and procedures. So below that, we'll see the scoring table. Each of the 27 elements has a separate scoring measure based on the factors. So you will see the scoring table for this specific element. So for element A of standard 1, you make 100% of the possible points, in this case 4, by meeting all 4 factors. 25% of 4 is 1, so if you see under 25%, it states that you can receive this 1 point from this element by meeting factor 1, which is providing same-day appointments. But it is critical that you remember for all must-pass elements, you have to at least receive a score of 50% to obtain NCQA recognition. In this case, that means the practice meets 2 factors, including factor 1. So you see that factor 1 in this element is the critical factor. Critical factor means, in most cases, to receive any points for the element, you have to at least be able to meet the criteria of that factor. Some elements have no critical factors, and some have up to 2. And for 50% of the score, where it states that the practice meets 2 factors, this means any of the listed factors, including the critical factor, which is factor 1. Below the scoring table, you will see the explanation section, which does explain the element. In this section, it clearly defines each factor. So for factor 1, which is providing same-day appointments, the practice reserves time for same-day appointments, also referred to as open access, advanced access, or same-day scheduling, based on patient preference or triage. Then it also states that adding ad hoc or unscheduled appointments to a full day of scheduled appointments does not meet the requirement. So as you can see, it clearly describes what is needed to achieve each of the factors. In the next section on documentation, which we'll see if we scroll down, it describes what needs to be submitted to prove you meet that element's factors. This section is really helpful because it provides examples for each factor of ways to prove that your practice meets those factors. For example, let's look at factor 3. It is looking for a documented process for staff to follow for providing timely clinical advice using a secure interactive electronic system, and has a report summarizing its actual response times. The report may be system generated or collected based on at least 1 week of electronic messages. And then it also states that factor 3 requires the practice to 1, define the time frame for a response, and 2, monitor the timeliness of the response against the practice's standard. And once again, you can really see how PCMH is all about system redesign through the practices, policies, and procedures. Let's look at the next element in this standard, element B, after hours access. This element is also worth 4 points. It is not a must-pass element. It has 5 factors, and here I would like to mention the NA option that is listed. In the explanation section, it will describe why that factor has this option. Here it states that factor 4 is not applicable if the practice does not have the capability to communicate electronically with patients. Also, by reading the explanation section and reviewing the scoring table for this element, you will find that factor 3 is the critical factor. This is a good example of where you may still earn points without meeting the critical factor. You will see this in the scoring grid under 25%, where it states the practice meets 1 to 2 factors or meets 3 to 4 factors, but not factor 3. If you wish to receive more than 1 point, you will have to meet factor 3. So for 50%, the practice meets 3 factors, including factor 3. Let's look at one more example. We can go ahead and jump to Standard 5, which is Track and Coordinate Care. This standard has a total of 18 possible points. And if we look at element B of the standard, which is referral, tracking, and follow-up, it is worth 6 out of the 18 possible points for the standard. Element B of Standard 5 is a must-pass element. This element has 7 factors, and there are no critical factors. For this element, in the explanation section, you will see that some factors are a core meaningful use requirement and a menu meaningful use requirement. If you are familiar with the CMS meaningful use requirements, you are aware that there are a set of 15 core requirements that providers must meet, and then a list of 10 menu requirements where the provider has to at least meet 5 of those 10. So in the standards and guidelines, it distinctly marks which factors are also meaningful use requirements. Here, factor 6 is a core meaningful use requirement, and factor 7 is a menu meaningful use requirement. So as you can see by this way, and to the extent possible, the patient-centered medical home standards are aligned with the CMS meaningful use requirements. Individual factors are identified in the standards as either core or menu MU requirements. In the appendix of the standards and guidelines, you can get an overview of which elements and standards line up with each of the CMS meaningful use requirements. Now, let's examine a few resources that are available to you during your recognition process. One great resource that is provided to you by the U.S. Department of Health and Human Services and the Office of the National Coordinator for Health Information Technology is the Regional Extension Centers, or REC. The RECs provide support services for achieving meaningful use of electronic health records. RECs provide live and on-the-ground training and technical assistance during your EHR selection and implementation process, and will also provide continuing support and assistance with your system. By going to healthit.hhs.gov, selecting the High-Tech Programs option in the left sidebar menu, and then choosing Regional Extension Centers from the expanded menu, you can find the nearest REC with contact information. Another great resource provided to you by the U.S. Department of Health and Human Services and through the Health Resources and Services Administration is a Health Center Controlled Network, or HCCN. Participation in a HCCN is meant to promote information sharing and pooling of resources with other FQHC programs. By working together, providers in a health center control network can share personnel and resources in key administrative areas to help reduce costs. HCCNs are meant to provide support on several topics, such as reducing fragmentation of health services and developing culturally and linguistically appropriate patient documents. But for PCMH recognition, health center control networks can help with IT development and management and electronic health record systems. This type of collaboration gives providers the opportunity to learn from and support each other through the successes and failures of the health IT implementation process. There are many benefits to joining an existing health center controlled network versus purchasing an EHR independently. The biggest benefit to joining a network is gaining valuable insight on adopting and implementing health IT, which can facilitate your program's adoption. Also, an HCCN allows greater access to a higher level of expertise, in turn reducing the cost and burden of locating and hiring experienced personnel. You can find an abundance of information on health center controlled networks and locate a network near you by visiting the website provided on this slide. If you are facing some challenges in the recognition process, please do not be discouraged. There are many resources that are available to you. The National Committee of Quality Assurance offers many different training events on PCMH, such as free online trainings, live webinars, and regional 2-day-long training events, which include a review of each of the 27 elements in detail. Please visit their website for more information on their offerings. Other local and state resources can also provide some assistance. Contact your local health department or primary care association to find out if they have any state-specific programs that will assist you with the PCMH recognition process. A listing of state and regional primary care associations is available by following the link provided on the slide. You can also find an extensive list of resources on the Patient-Centered Primary Care Collaborative or PCPCC website. This is especially beneficial for developing materials for Standard 1, Element E, Medical Home Responsibilities. I invite you to continue to use the National Healthcare for the Homeless Council as a resource for your organization. You can find many of the Council's resources online, and they are available to you at no cost. These resources include the Geiger-Gibson study mentioned earlier, which can be downloaded from our homepage. Another helpful resource that is available on our website is the PCMH Resource Guide. That can be found by going to our resource section under Publications. If you scroll down on the left-hand menu, you will see PCMH Resource Catalog, and that will open up in a separate window. If you're back on our homepage, go to the Training and Technical Assistance drop-down menu and select Webinars. Here you'll see a listing of not only upcoming webinars, but also archived versions of past webinars. Please don't forget to sign up for an upcoming webinar entitled Patient-Centered Medical Home, a Case Study on Achieving Level 3. We understand that there is a belief out there that because of the population we serve, we will not be able to meet some of the standards that deal mainly with tracking, follow-up, and patient use of health IT. But for those of you out there that have this in mind, we want you to know that there are Level 1 and 3 PCMH recognized Healthcare for the Homeless programs. We have contacts at these programs and collaborate with them frequently, so that we can provide technical assistance and trainings to you and your program. We will put you in contact with these programs so that you can discuss and receive feedback on some challenges your program may be facing in the PCMH recognition process. It is also helpful to hear from similar programs how they were able to deal with some of the same issues you are currently facing, especially with the workflow redesign and practice transformation. We have subject matter experts from Patient-Centered Medical Home recognized Healthcare for the Homeless programs and from Healthcare for the Homeless programs who use electronic health record systems similar to yours. So please feel free to submit a request for technical assistance so that we may fully assist you with your issues. To do that, from our homepage, select the Training and Technical Assistance drop-down menu, go down to Technical Assistance, and select Request. Once the page is open, you can scroll down and begin filling out the fields in the TA request form. After you complete the required fields, you will click on the Submit button. Staff will receive your request and begin working on developing a response to your issue and connecting you with the SME. We have come to the bottom of our agenda for this presentation entitled Steps to NCQA Recognition for Patient-Centered Medical Home. On behalf of the National Healthcare for the Homeless Council, I would like to thank you for your interest and participation in this pre-recorded presentation, and we hope that it has provided some clarity and assistance on the topic of NCQA PCMH 2011 standards. If you feel that others can benefit from this information, please feel free to forward the link from our website. For any questions regarding this webinar, please contact me by email at jhishida@nhchc.org or by telephone at 615-226-2292. We do ask that you take a moment to provide feedback on this webinar by completing an online survey. The URL for this survey is provided on the slide. Thank you.